Good evening. This is Artisha Porter from your Advanced Social Work Research Methods class at Jackson State University with Dr. Lee. And today I will discuss the program evaluation proposal. And in the inva- and in the evaluation proposal, I will discuss the intro and background description. The program being evaluated is Brentwood Behavioral Health Care, Mississippi. It is a behavioral health facility that provides psychiatric services. They specialize in treatment for adults, children, and adolescents. Brentwood Behavior offers both inpatient and outpatient psychiatric services, located in Flowood, Mississippi, and Rankin County, which is close proximity to Hinds and Madison counties. They help individuals and families achieve optimal mental health. Families achieve mental health, which I just said this, resulting in improved quality of life. The Logic Model is a tool that has been used for more than 20 years by the program's managers and evaluators to describe the effectiveness of their programs. The outcome with the problem first here is that students with mental disorders have a hard time functioning in a regular classroom setting on a daily basis. Inputs regarding to this type of setting will deal with time, money, partners, equipment, and facilities. Outputs are the workshops, publications, field days, equipment demonstrations, and anything dealing with psychiatric services. The outcome will consist of a short-term goal, which will give knowledge, skills, attitude, motivation, and awareness. Long-term goal will change in the environment, social conditions, economic conditions, and political conditions. Reasons need for conducting an evaluation on Brentwood to make sure the medicine is being prescribed correctly and being dispersed to those in need for it. Ensuring that group work, individual therapy, and patients are being treated good. That all patients' needs are being met upon staying and release. A description of uses used to evaluate information to be generated will come from the supervisor. Flyers, emails, social media, conferences, texts, and rallies will be in the place for information to be generated amongst different counties. The evaluation environment administrative staff will consist of chief medical officers, directors, dietary, and many others on staff. Next, I will talk about the dependent variable. The independent variable first of policy for Brentwood is the notice of non-discrimination privacy policy. The dependent variable or outcome objectives for the clients is to never return and try to stay out and live a healthy life. Taking medications on time and getting refills as needed when pills run out. This way, no outbursts or problems occur in places that they should not, like for instance in schools. The problem, again, is mental illness in attending mental facilities, lack of education and social environment, the problem of students not functioning in public school settings. The evaluation is intended to answer this question. The problem is the students with mental disorders are having problems in a normal classroom setting. Many students attend Brentwood Behavioral Health Care for their problem. I chose Brentwood to evaluate because I would like to know that all client needs are being met. I also wonder about the patient outcome data to see if the majority get better and not have to come back, or do they keep relapsing. It's getting the evidence, data, assessments, interventions, treatments, and one-on-one with the doctor treatment should have a good outcome. Are the returning students on the proper dose of medicine that will help them focus and eat on a daily basis? Before many of the medicated students do not eat or talk, and I think this is a terrible way for a child to endure. I'm actually fine with physically disabled kids attending public school, but I'm not fine with mentally disabled kids going to public school. I feel that they should have a school separate for them just to meet their certain goals and needs that they need, because they need individually help. I feel because some just really can't help themselves on medicine or without medicine. Um, methods in sharing. Methods research design and experimental classic design is standard against which other designs are compared. This evaluation is a more rigorous type of evaluation when the goal is to infer an intervention for behaviors either did or did not have an effect. Participants randomly assigned to either the intervention or control group. This allows the evaluator to assume groups are equivalent at the start of the study, but no guarantee that it is true. Comparability or similarity of the groups is much more likely to occur if the population is large and the size of each group reaches or exceeds 25 to 30 persons. If the sample size is small, then even random assignment may not produce equivalence. Many possible distributions could occur, such as an outlier distribution. The evaluator can check at time or pretest to confirm groups are roughly equivalent. A number of limitations occur with the design, such as a total lack of control. Also, it is of very little scientific value as securing scientific evidence to make a comparison and recording differences or contrasts. There is also a tendency to have the error or misplaced precision, where the researcher engages in tedious collection of special detail, careful observation, testing it, etc., and misinterprets this is obtaining good research. However, maturation, selection, mortality, and interaction of selection and the experiment variable are all threats to the internal validity of this design. Then there's an example of the program logic model as well. The literature review discusses the different articles. One of the articles was mental health article defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, and can work productively and fruitfully, and is to make a contribution to his or her community. The article discussed about positive dimensions of mental health and is stressing whose definition of health as contained in its constitution. Health is a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. My thoughts on this mental health for state of well-being article was very informative. I can agree with the decisions throughout the article because the author felt that having any kind of mental illness does not count you out as an individual, and that is true. All children should be treated the same no matter what their illness is. This part I found rather interesting to me because I think and feel the same way about the illness. The article discussed positive dimensions of mental health and how to overcome those fears one day at a time. It talked about how people should treat people with a mental illness. Stop counting them out because you're afraid to speak out and up for this kind of individual. You never know who help you will need one day. It makes you put yourself in that person's life and see how people treat you on a daily basis. I feel that many people judge quickly but really have no clue about mental illness. I was raised that you treat others how you would want to be treated. Next is measurement and sharing results. The main program objectives will be measured using a scale adapted by Walt Hudson, a prominent social worker researcher. The attitude scale may measure changes in affect, true, false, multiple choice, or short-term, short answer questions, may measure changes in knowledge. Behavior change may be assessed through the use of a behavior checklist. In some cases, existing measures match the desired outcome of a program. Where this is the case, the next challenge is the collection of this data. In the ideal situation, the measurement is integrated into practice. Environmental change measures are less well developed. Given the emphasis in social work on the person in the environment, it is ironic that there are few measures of this type. Some limitations occur with this status change measure. Some people argue that they are adequate indicators of the condition of the client. The data will be collected by survey from teachers and parents in the public school system and in surrounding hospitals. The survey will contain questions about how children act on medicine and how they act without the medicine in the classroom setting. These results will help the doctors decide what is good and healthy for children and what's making them act even badder when they do not have the medicine. The staff will set up professional developments on Mondays, Wednesdays, and Fridays at JSU campus to take surveys about children's behaviors with and without medicine. The staff will set up near the public schools and hospitals as well. I said that already, in the surrounding area. The analysis plan, the author will analyze the data collected from the parents and teachers. TAPS, pre-simulation and post-simulation surveys will help determine any changes in the client's knowledge, awareness, or behaviors in relation to the realistic demands of parents, teachers, doctors, and friends. Further, we will analyze the client's scores on the weekly surveys and determine the strengths and knowledge of the particular problems and topics addressed through classroom instruction and the program policy and procedures. Additionally, data indicated on the TAPS will be analyzed. The expected results, the expected demographics of the population study are reported in the following table. One of the Brentwood programs that is linked through